Greetings, I'm Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings and Professor of Anesthesiology at Mayo Clinic in Rochester, Minnesota. I'm joined today by Professor Dan Ariely of Duke University. Professor Ariely is the James B. Duke Professor of Psychology and Behavioral Economics at Duke. Together, Dr. Ariely and I have written an editorial entitled Disturbing Trends in Physician Burnout and Satisfaction with Work-Life Balance, Dealing with the Malady Among the Nation's Healers. This article introduces an original article by Shanafelt et al. From Mayo Clinic in Rochester, Minnesota. This research examined physicians' perspectives over two periods separated by 3 years and compared the data from that research to results from the broader U.S. population. Dr. Ariely and I discussed the basis of these problems, these maladies if you will, and we attribute those to three factors: asymmetric rewards among physicians, low level of autonomy, and cognitive scarcity. Dr. Ariely.
Okay, so the evidence about stress and lack of happiness among physicians is very clear from this article, very distressing and very clear. And what we were interested in is thinking about what could cause that, because stress could come out from lots and lots of things. And it obviously comes from lots of things, so we're not saying that these are the only three things, but those are kind of interesting psychological building blocks for stress. So the first one is about asymmetric reward and punishment. So imagine that every time you walked in the halls of this office and you found the right door, it will be fine, but every time you went into the wrong room, you will get a big electrical shock, something just terrible. What will happen? Well, there were experiments like that, not with people but with rats many years ago, in which they showed that as the intensity of the shock increases, in the beginning the rat finds their way faster and faster because they're motivated, but at some level the shock is so large that they get paralyzed and performance goes down. And we've shown similar experiments with other types of rewards, showing that when people have big punishments and they're afraid of losing big amount of money, it can actually stifle their ability to think. So imagine you're in surgery and you're operating on me, and just before I go under the knife I say, look Bill, if you'll perform well, I'll give you a nice book at the end of this, but if you don't perform well, I already hired a hitman to wait for you outside the clinic. And how likely are you to be able to focus on the surgery, right? Your brain will be partially occupied by thinking about the negative consequences, not leaving enough space to actually do the job. So that's the first element we kind of try to elaborate and get people to think about. The second one is autonomy. Autonomy is just so common. When you give people control over their environment, you allow people to decide how to spend their time and what to do and so on, people are inherently internally motivated. But the moment you create a bureaucracy in which people don't have the freedom to choose what they want and they just kind of robots doing a particular job, joy goes away, judgment goes away, and goodwill goes away. If you think about it, we depend so much on people's goodwill, but the moment you take autonomy away, goodwill goes with it. And the last thing we emphasize is this idea of cognitive scarcity. And the idea of cognitive scarcity is that when we are occupied all the time with how to manage our time and what decisions to make, we actually lose our ability to think. It's kind of incredible. There's this research on what is called depletion. And depletion basically says that thinking is a little bit like a muscle. If you lift a weight, you lift, at some point you just can't do it anymore. And it turns out that when we are occupied with difficult decisions about our time, other people's time and so on, we get this mental depletion, and therefore our capacity to make decisions later in the day goes down. So the main point we're trying to make is, yes, we have this stress, the evidence is very clear, but I think we're doing it to ourselves, or we've created a medical system that make these stressful results very likely, and I don't think we're going in a better direction. If you look at, actually I don't know, what do you think when we think about how Obamacare is going to progress? Are there going to be more of these things? Is there going to be more autonomy? Are we going to have less asymmetric punishment? And are we going to have less kind of cognitive demand, or is it going to get worse?
Well, certainly the literature suggests that there are older and sicker patients coming into the system. Recent healthcare reimbursement reform will bring more patients into the system, and recent guidelines, for example, the treatment of diabetes mellitus, hypertension, lipid abnormalities and whatnot, are going to demand that we have a higher level of attention for these conditions and treat them at a higher, more discriminating level than ever before.
Yeah.
And all this equates to increased physician input, increased judgment, increased time.
Yeah. So I'm not too hopeful right now, but I think we do have to kind of stir the boat in a slightly different direction, and hopefully we'll start.
Thank you very much, Dr. Ariely. We hope that you've enjoyed this discussion, and we highly recommend you read the research article of Shanafelt et al., and hope you gain additional insights from our editorial. Thank you. We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.